Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us for another segment. The COVID-19 pandemic changed how consumers access care and brought healthcare payers and providers together to better enable providers to care for patients when they needed it most. Well, joining us is Angie Meoli. She's Senior Vice President of Network Strategy and Provider Experience at Aetna, and that's a CVS Health company. She's joining us to talk about some of the trends that emerged during this COVID-19 pandemic and which of these trends will continue after the pandemic ends, in her opinion. Welcome to Health Professional Radio, Angie Meoli. Thank you for taking the time.
Hi, thanks so much, Neil. It's great to be with you today.
You're Senior Vice President, Network Strategy at Aetna. Give us a bit of your professional background and talk briefly about your role there at Aetna.
Sure. Thanks, Neil. So I've been in the healthcare profession for probably close to 25 years now. I've had the privilege of working, I like to say, in a little bit of all segments of healthcare. I've been in the provider world. I've been in the employer and consumer plan sponsor world, as well as now most recently with Aetna and CVS in the payer space. My role at Aetna is really to curate and develop strategic initiative as well as the tactical of bringing together provider networks to serve our consumers for all lines of business. So my team and I are responsible to ensure that our government businesses, our commercial businesses, our individual businesses, dental as well as behavioral health, have a quality and effective, affordable provider network available for them to be able to get their health care quickly and conveniently when, where, and how, and what they want.
Of course, we all know that the pandemic basically restructured the entire world, no more so than in healthcare. Everything had to be restructured. Doctors had to decide how much time they were going to spend in telehealth, and payers had to decide how they were going to pay for telehealth. That was just one of the many aspects that changed because of the pandemic. What are some of the trends that you see that you think will continue once this pandemic is under control, if it is going to be under control?
Yeah. So, I think it's really fascinating if you think back when the pandemic began. Payers, providers, consumers, patients, members, all of us who are constituents of healthcare were experiencing things that we've never experienced before. Providers were needing to restructure their practice, their facilities, emergency rooms, et cetera, to isolate COVID patients. Elective procedures were canceled or rescheduled, and even just, primary wellness care was put on hold. And very quickly, we all recognized that there was an immediate need to start to embrace the practice of virtual care. And telemedicine and virtual care has been around for a while, but it really had been previously viewed more as an urgent sniffle, cough, and cold. Hey, I can't get in to see my doctor. And we really had to very quickly think about transitioning to how virtual now became a modality of delivering care that was part of our everyday delivery of good quality, not just wellness, but also emergent and urgent care. And I think it's one of the trends that will continue, Neil. It's one of those things that it's like the genie, it's out of the bottle. Mm-hmm. And I think that there's not only are consumers favoring it and are seeing that, there's convenience, there's quality delivery of care, but providers as well have really embraced the ability to think differently about how they organize their practice and when, why, how, and where they need to see their patient.
Before the pandemic, telemedicine, video conferences with your physician, they weren't, as widespread, but those situations did exist. How involved with telemedicine was Aetna before the pandemic?
Yeah, it's a great question. We absolutely embraced telemedicine. We had not only some specific products directed specifically and vendor relationships with Teladoc and others to really call out the opportunity to use telemedicine as a mode of care. Of course, our CVS Minute clinics offer telemedicine as well. So we had already embraced it as part of care delivery. But I'd say that, what changed is as the pandemic progressed was the activity and the embracing of providers, all providers. So, prior to the pandemic, I would say, in the payer world, we all were offering some version of virtual or telemedicine, but the widespread acceptance or adaptability was not there from all providers, where when the pandemic hit, it became quite clear to providers that this was something that they needed to really think about and they had to embrace because they had patients that they wanted to take care of, and that's the core of everything that they do every day.
Taking care of patients, that's the norm, of course, but the pandemic kind of changed, I guess, the attitudes and some of the behaviors as those attitudes and behaviors related to mental health care. It seemed that mental health kind of was over there for a while, but once the pandemic hit with the isolation and the lockdowns, people losing their jobs, their financial stability, their homes, mental health became a lot more at the front of everybody's minds, especially when it came to telemedicine.
Yeah, it's again another interesting aspect of what we saw coming out and through the pandemic, and that it's one of those items where I've always been a big believer in that, from challenge and sometimes not, great situations, you do pull through golden opportunities and nuggets. And there's been a stigma attached to people accessing mental health support, and the pandemic really helped start a meaningful conversation on mental health. Moving forward, I hope this openness will continue so that people can access the care they need. But really what we saw is exactly what you said. There were consumers that, because there was such a dramatic change in their daily life, and that change could be everything from I don't get in my car and go to an office and, hang out with coworkers like I used to every day, and I live by myself. And now I'm sitting in my house and I have no one to talk to. To it could be, an autistic child who has been in therapy and couldn't get to that therapy. So there were so many, challenges. And then you added the point of just the economy. People losing their jobs, people having to make choices because they had children who had to have school at home and they couldn't work, right? There was an immense and intense amount of pressure on mental health throughout the United States. And so, again, I think that what we saw is a very quick coming together, if you will, of not just caregivers, but consumers and payers to think about how do we start to address this, because it's something we need to get on and get ahead of now. Because if you wait, the long-lasting impression will far outweigh our ability to really then care for the needs of those individuals. I think about the need to collaborate on behavioral health. We've been increasing access to behavioral health care by growing our network. We've developed more than 280,000 behavioral health and employee assistant programs with providers. We also continually are working on growing and enhancing the quality of the network in innovative ways. For example, traditional metrics include things like proximity, so closeness of a provider to members, right? Time and distance. We're going beyond that to think about how members have been recently served and creating new innovative provider partnerships to maybe not also just think about that time and distance, but are they getting to the right provider? How can we complement virtual behavioral health into their care delivery? So it's exciting work. It's meaningful work. And I think that as we think about even continuing to go into different facets of behavioral health, autism, substance abuse, eating disorders, there's a lot of opportunity for us all to continue to drive harder in making that access to care affordable and accessible.
Now, CVS, which is an Aetna company, was instrumental in testing and the rollout of the vaccine. I do understand that you're also going to be offering behavioral health consultations or care in some of your select locations through your Minute Clinic and your health hubs.
Yes, that's correct. We are offering clinical counseling and services from licensed clinical social workers at select CVS Minute Clinics and Health Hub locations. So we've started rolling out specifically in Texas. We have a number of locations that have LSCWs on staff, and the interest has been really overwhelming. And, you know, I think interest not only from employers and plan sponsors, but also interest from providers in the community who are looking for resources to be able to help their patients get to the right behavioral health care.
Give us a website where we can learn more about CVS and Aetna's involvement in bringing us back to some sense of normalcy.
Sure. So two resources and websites. The first would be CVS.com. So CVS.com has a wealth of information not only about COVID and how our retail store locations and Minute Clinics are responding to COVID, but also a lot of information relative to vaccines, because vaccines are so important. And then also I would also point your listeners to Aetna.com. Aetna.com will specifically talk through what we've been doing with the response to the pandemic, not only some of the liberalizations, plan sponsor, member resources, but also many provider resources, so the providers can have at their fingertips ways to better address questions from their patients, think about vaccine hesitancy, and really get information that they need right now during, as we hopefully come to the end of a pandemic.
Well, Angie, I appreciate you joining us here on the program. Thank you very much.
Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Angie Meoli. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.